Hello, my friends. I'm Dr. Emma Blake, urology and men's health expert. And today we're going to have one of the most open, honest, and yes, slightly blush-worthy conversations. The kind of question many people carry silently, but rarely get a chance to discuss openly. I believe it's time to bring those questions into the light. Because when we talk honestly about intimacy, not only do we learn, but we also heal, we connect, and we realize we are not alone. So, welcome back to this space, a safe, respectful corner of the internet where we talk about sexual health, confidence, and intimacy at every age. Whether you're tuning in from a busy city apartment, a serene garden, or a quiet retirement community, this conversation is for you. Because here's the truth. Intimacy does not retire, passion does not have an expiration date, and love when cared for only deepens with time. Now let's go right into today's big question. It's one I get far more often than you might imagine, and I know some of you may already feel a little shy just hearing it. The question is this: is it safe to swallow vaginal fluids during oral intimacy? What about the taste, the smell? Is it normal? Is it healthy? These are questions whispered in private, searched for late at night online, or asked hesitantly in my clinic with lowered eyes. But here, we're going to talk about it openly, without shame, and grounded in science. I want you to stay with me even if you feel embarrassed, because by the end of this discussion, you'll feel informed, reassured, and more confident in how to approach intimacy. All right, let's begin. Oral intimacy is no longer the taboo it once was. Today, many couples, even in their 60s and 70s, discover it for the first time and describe it as opening a brand new chapter in their relationship. But as with all intimate practices, it comes with responsibility. Anything that enters the body, yours or your partner's, deserves knowledge and care. So, let's start with the fundamentals. What exactly are vaginal fluids? Are they safe to swallow? What determines their taste and smell? And most importantly, how do we keep intimacy not just pleasurable, but safe, respectful, and affirming? So, let's start with the basics. What exactly are vaginal fluids? They're not random moisture, and they're certainly not something to be embarrassed about. Vaginal lubrication is the body's natural masterpiece, carefully designed to reduce friction, protect delicate tissue from infection, and signal readiness for intimacy. Even beyond fertility years, these fluids remain an important part of the body's way of making intimacy comfortable, safe, and pleasurable. There are three main sources that work together to create this lubrication. First, the Bartholin's glands. These are two tiny glands at the entrance of the vagina. Their role is to secrete a silky fluid at the beginning of arousal to reduce friction. Second, the skin's glands located near the urethra, sometimes called the female prostate. They produce additional fluid during deeper arousal. These glands are also involved in female ejaculation for some women. And third, the cervix, which produces fertile mucus at certain times of the cycle. Even outside of fertility, the cervix contributes fluid that helps maintain balance and moisture. Together, these create vaginal lubrication, a fluid that may appear clear, slightly milky, or somewhere in between. Think of it as nature's way of preparing the body for connection. Now let's talk about taste and smell, because this is where most questions come from. Just like with sweat or saliva, vaginal fluids have natural variation. Hormones, hydration, diet, stress, and even medications can influence how they taste or smell. For example, when a woman is hydrated and eating a diet rich in fruits and vegetables, her fluids may taste lighter or even faintly sweet. Foods like pineapple and citrus are often associated with a fresher taste. On the other hand, garlic, onions, coffee, or alcohol can make the taste stronger. Hormones matter too. Around ovulation, fluids are usually more abundant and neutral. Around menstruation, there may be a faint metallic note from trace amounts of blood. After menopause, reduced estrogen can make fluids less plentiful and sometimes slightly more acidic. And here's what I want you to remember. None of this is abnormal. A woman's natural scent and taste are part of her individuality. Just as no two men smell the same after a workout, no two women taste the same. But sometimes the taste or smell may feel off. That doesn't mean shame or embarrassment. It means the body is signaling something. Common reasons include sweat, trapped by tight clothing, traces of urine near the vaginal opening, or a vaginal imbalance such as bacterial vaginas or a yeast infection. These are very common, easily treatable, and nothing to be ashamed of. The problem comes when silence and shame replace communication. Embarrassment grows, intimacy suffers, and couples pull away from each other. All because no one explained that these changes are normal and treatable. Now let's answer the big question directly. Is it safe to swallow vaginal fluids during oral intimacy? The short, reassuring answer is yes. For healthy partners, it is generally safe. Vaginal fluids are not dirty or toxic. They are mostly water along with amino acids, enzymes, trace minerals, glucose, and lactic acid, all designed by the body to keep the vagina healthy and protected. From a medical perspective, vaginal fluids are often less risky than things we do without thinking, like kissing deeply, sharing a drink, or even eating fruit that hasn't been and washed perfectly. But, and this is important, safety depends on health status. Vaginal fluids like semen or blood can carry sexually transmitted infections. Conditions like chlamydia, gonorrhea, herpes, syphilis, trichomoniasis, and HIV can all be present in secretions. The risk is higher if one partner has an active infection, and even more so if the receiving partner has open sores in the mouth, bleeding gums, or ulcers that allow those pathogens entry. This doesn't mean you need to live in fear. What it means is that love and wisdom should go together. And wisdom here looks like knowing your status, having open conversations about sexual health, and making routine testing a normal part of intimacy, just like you'd check your blood pressure or cholesterol. I'll give you an example. A patient of mine in his 60s called me after becoming intimate with a new partner. He admitted he had bleeding gums from brushing too hard and panicked that he might have exposed himself to HIV. His fear was real, but the truth was this. The risk of HIV from oral intimacy is very low, though not zero. I encouraged both partners to get tested together, and they came back negative. What happened next was remarkable. The act of getting tested actually brought them closer. They felt safer, more honest, and more connected. This is the deeper truth. Safety doesn't destroy romance. It strengthens trust. When you and your partner know you're both healthy, intimacy becomes freer, more fearless, and much more joyful. So here's what I recommend. Step 1. Have the STI conversation. Ask gently about testing, or better yet, suggest getting tested together. This is not mistrust, it's partnership. Step 2. Use barriers like dental dams if needed, especially early in new relationships. They may sound unromantic, but in reality, they're a sign of care and responsibility. Step 3. Make routine testing art of your health rituals, even for long-term couples. Twice a year is a healthy standard. If you and your partner are healthy and infection-free, then swallowing fluids is safe. More than that, it can be an act of deep acceptance. Many women actually feel more cherished when their partner embraces them completely without hesitation. It says, I trust you, I delight in you, I accept all of you. Now let's address another part of this conversation that most people are too shy to say out loud: the taste and smell of vaginal fluids. First, let me reassure you, variation is completely normal. Fluids can be mildly musky, salty, tangy, or even faintly sweet. Hydration, diet, hormones, and stress all play a role. Fruits like pineapple, citrus, and berries often make fluids taste lighter, while things like garlic, alcohol, or coffee may give them a stronger edge. Hormonal shifts, ovulation, menstruation, menopause also naturally change how fluids taste and smell. And here's what I want every man to hear clearly. A woman's natural scent and taste are not defects. They are part of her health and individuality. They should never be a source of shame. The only time to be concerned is if there's a sudden, strong, unpleasant change, especially if accompanied by itching, discomfort, or unusual discharge. In those cases, it may be a simple imbalance, like bacterial vaginosis or a yeast infection. Both extremely common, both very treatable. Here's where your response as a partner matters. If something seems different, don't recoil. Don't criticize. Don't make a joke. That will only create shame. Instead, approach it with kindness. Suggest a refreshing shower together. Encourage hydration. Make it a team effort, not a judgment. When couples treat changes in the body as something to face together, intimacy actually grows deeper. Now let's talk about the emotional meaning. For many women, especially in midlife and beyond, acceptance is more powerful than technique. When a man chooses to embrace his partner fully, including her fluids, he communicates, "I accept you completely. I love every part of you." That message heals years of quiet shame many women have carried about their bodies. It turns intimacy into trust, and trust into deeper pleasure. And gentlemen, here's a secret. When a woman feels that safe, her arousal deepens, her orgasms are stronger, and her willingness to be fully present with you multiplies. Acceptance is arousing. Judgment is shutting down. So, is it safe to swallow vaginal fluids for healthy couples? Yes. Is variation in taste and smell normal? Yes. The real key is communication, honesty, and compassion, because intimacy, at any age, is not just about mechanics. It's about how deeply you make your partner feel safe, desired, and accepted. And before we close, I want to mention something important for men. Too many guys waste money on unsafe, unproven pills from the internet. That's why I only recommend 2 safe, evidence-based supplement options. You'll find both linked in the comments and video description below. For men who want a moderate clean boost, I recommend organic watermelon extract, rich in litroline. It improves nitric oxide, boosts blood flow, and supports firmer, more reliable erections. But if you want a much bigger transformation, not just better circulation, but also stronger testosterone, stamina, libido, and even prostate support, then I recommend the advanced formula. It combines Ikurin horny goat for blood flow, hardness, and stamina, Tonkat Ali for testosterone support and libido, fenugreek for desire, energy, and orgasm intensity, nettle root for hormone balance and prostate health, citrine for nitric oxide and vascular performance. Together, this formula supports every part of male performance: circula, chin hormones, stamina, desire, and prostate health. So whichever option fits your goals, you'll find the links right below in the pinned comment and video description. Take care of your health, your confidence, and your intimacy, because passion doesn't retire.